Okay, my next talk is on, I've done extensive work on tuberculosis, both active and healed. As all of you know, it's a very notorious, unpredictable organism, and it is widely spread in India. So yes, there is a possibility when there is an active cox, hip. So in selected cases, that is what I'll just share with you from my experience. So a lot of people have tried, but Kim Yoo-hum, who has really broken the ice, and he started doing with some special preoperative debridement and chemotherapy. And there are a lot of papers now which are coming up, so possibility of active TB can be managed. Also healed TB. So causes of reactivation are inadequate clinical selection criteria, inadequate anti-TB medication, no effectivity assessment of ATT medication, no immunological status assessment. CD4 count is a very good parameter which we studied, which gives a host immunity. So if you do THR in patient with good immunity, it works better. Similarly, there are a lot of spine studies which shows that biofilm formation is less in TB. So I have got an extensive experience of 133 cases, and to share you, there is a no reactivation in any of this case. So these are the 10 commandments, whatever from my study. One is, of course, you do when there is an arthritic stage, because synovitis, it is completely reversible. You must give an effective pre-op and anti-TB medication, initially with 5 drugs for 3 months and then 9 months. A patient with discharging sinus, you should not accept, because when there is a discharging sinus, the outside organism, septic organism are mixed, and it is not a good case, and it is like a septic arthritis. So no discharging sinus should be there pre-op. At the end of 3 months of anti-TB medication, when you start the case, the ESR should be less than 50. It should be showing good downward progression. Same with the CRP. It should be less than 10 when you select. No pus on MRI. MRI is a very important criteria. Patient's immunity should be good, and CD4 count is a good parameter. The CD4 count should be more than 500. Patient should be well nourished, good immunity, HIV negative, no large bone cavities more than 10 millimeter from the acetabulum, no bone lesions away from the cartilage 10 millimeter, and no active pulmonary TB. Healed TB, you have to give post-op anti-TB medication. Few example, healed TB, you can see 25 years ago he was done excision arthroplasty, and he was limping like this. There was a shortening. It was an active TB case. They tried everything, but which failed, resulted into excision arthroplasty, and he was, there was no sinus. He was limping with severe shortening, and we did with post-op anti-TB medication, and he is walking actively with good reconstruction. So active TB, most important is a 3-month effective anti-TB medication. A classic TB, you can see classical destruction. So after good preoperative backup and good response, you select the case and do THR, and you can see 11 years follow-up, he is enjoying walking. One more case, he is a policeman, and you can see he is as active as before. After 15 years of active TB, he was bedridden. Protrusio, you can see this is a classical active TB prone on MRI, and she is enjoying, and she is now more than 19 years follow-up. Pathological fracture patient had a TB hip, arthritis, and he had a fall, minor trivial fall, and he developed a fracture neck femur with arthritis. An ideal case, MRI also proved everything, active TB. Mortar and pestle type, she came from Lucknow with classical and responded very well to anti-TB medication. And we did, that time metal was there, but excellent activity. Bilateral hip arthritis, very rare in TB, but this was a case of proven bilateral involvement. Wandering acidulum. So classical, as we describe in the books, complete destruction of the superior part, you can see here. And it was active and responded very well to anti-TB medication. So we accepted the case. And you can see the mobility. He's got full mobility, enjoying lifestyle. Sometimes the spine is also associated with the TB. As you can see in this young girl, the spine is also involved. And if you follow the same protocol with good response of pre-op anti-TB medication, this is a 14-year follow-up. You can see she's enjoying the mobility. Spine is also healed just by anti-TB medication, and THR has given beautiful movement. I was again, one more topic was given for this guest topic, 2004 British Orthopaedic. I published in 95 in one of the journal, and it's a big honor for us for 2021 Journal of Orthoplasty. So everything is written in this chapter. So conclusion, it is possible if you select a case and shows good response of anti-TB medication and follow those 10 commandments, there is a possibility in active TB selected, you can do THR. And healed TB, it is always better to protect with anti-TB medication post-op. So no discharging sinus, no frank pulse on MRI is very important pre-op requisite. And post-op, you must give 10 to 18 months of anti-TB medication. Good immunity status, CD4 count is my study, and that is a very important preoperative landmark. And lesion should not be away from the acidulum. Thank you very much.